The thing is, the thyroid antibodies develop before the thyroid gland is affected, yet most doctors will wait until the thyroid gland is actually affected. So, why do some people develop thyroid antibodies? Well, there's something called the Triad of Autoimmunity. Those factors are necessary for autoimmunity to develop and thus thyroid antibodies to develop. It's not uncommon for people to have all of these antibodies. Some people will have a combination of the two, like they might have thyroid peroxidase as well as TSI. In fact, literature shows like 60 to 80% of people with Graves' disease will also have thyroid peroxidase antibodies. So when should you test the thyroid antibodies? This is the first of multiple episodes where I focus on how to lower and normalize thyroid antibodies. While I do have other episodes where I discuss this topic, since many people have questions related to thyroid antibodies, I figured I would create a series where I dedicate individual episodes where I discuss the different factors that can help you to lower and eventually normalize thyroid antibodies. Now, I want to start out by mentioning that lowering thyroid antibodies as well as normalizing thyroid antibodies, it's not an easy process. It can be challenging to accomplish this. So at times I might make it sound like it's easy, but it definitely is not. It can be challenging to find and remove the triggers, can be challenging to heal the gut. So just wanted to let you know up front. Again, that could be a challenge, but that's also why I decided to dedicate specific episodes, just because having one single episode talk about thyroid antibodies can be helpful as well. But still, just because it can be challenging, I thought it would be helpful to have a series of episodes where I go into greater detail about this. So let's talk about what antibodies are. So, what are antibodies? So, an antibody is a Y shaped protein that is part of an immune system response to something called an antigen. And an antigen is a foreign substance that causes an immune response. Examples include pathogenic bacteria, food proteins, chemicals. And so these antibodies are secreted by something called B cells of the immune system, and they essentially serve as a form of protection. So, why do some people develop thyroid antibodies? Well, there's something called the Triad of Autoimmunity, and the Triad of Autoimmunity has three components. And component number one is a genetic predisposition. Component number two is exposure to one or more environmental triggers. Component number three is an increase in intestinal permeability, which is the medical term for a leaky gut. So those three factors are necessary for autoimmunity to develop and thus thyroid antibodies to develop. And there are different types of autoantibodies. And so we're going to focus, of course, the ones that relate to thyroid autoimmunity here, but there are many other autoimmune conditions, and they each are associated with different types of antibodies. So the most common type of thyroid antibody is called thyroid peroxidase or TPO antibodies. So, thyroid peroxidase is an enzyme that's important in the formation of thyroid hormone. And when you have these thyroid peroxidase antibodies, the actual antibodies aren't doing anything. They're more of a, well, they're not always a consequence. So, like thyroid stimulating immunoglobulins, which I'll talk about next, they actually do affect the thyroid. But many times, these antibodies are a consequence of the autoimmune component. And that's the case with TPO antibodies. So, they're not actually doing damage to the thyroid gland. But when you have TPO antibodies, it could indicate that there is damage happening in the background. It doesn't always mean you have damage to the thyroid gland just because you have those thyroid peroxidase antibodies. But that definitely can be the case. And over time, if you don't address the autoimmune component, it can lead to hypothyroidism, so low thyroid hormone levels. Again, not always, but if you have elevated thyroid peroxidase antibodies, again, I would still recommend to do things to try to lower and normalize them, which is what this series is about. So, next antibody I'd like to discuss, thyroid stimulating immunoglobulins or TSI. So, these are associated with Graves' disease. And so, thyroid stimulating immunoglobulins, these actually do affect the thyroid directly. So, these bind to or stimulate the TSH receptor of the thyroid gland, resulting in the excess production of thyroid hormone. And also, I should mention TSI, the thyroid stimulating immunoglobulins, they're a type of TSH receptor antibody or TRAB, and you can actually measure the TRAB as well. I usually just stick with the TSI because the TSI, thyroid stimulating immunoglobulins, are more specific to Graves' disease. But I'll talk shortly about TSH receptor antibodies more because there is another antibody associated with that, not just TSI. But let's next talk about thyroglobulin antibodies. So, thyroglobulin antibodies are associated with Hashimoto's thyroiditis. And so, thyroglobulin is it's a protein of the thyroid. So, if you have those thyroglobulin antibodies, again, the antibody itself isn't damaging the thyroid gland, but the presence of these antibodies may indicate that you're experiencing damage to thyroglobulin. And you could also test for thyroglobulin too. So don't get that confused that if you're trying to look at the antibodies, you want to test for the thyroglobulin antibodies, not actually for thyroglobulin. And I also should add that it's not uncommon for people to have all of these antibodies, to have thyroid peroxidase antibodies, thyroid stimulating immunoglobulins, thyroglobulin antibodies. Some people will have a combination of the two, like they might have thyroid peroxidase as well as TSI. In fact, literature shows like 60 to 80% of people with Graves' disease will also have thyroid peroxidase antibodies. Now, when I dealt with Graves' disease, I did not have TPO antibodies. I just had the thyroid stimulating immunoglobulins, but a lot of people do have those TPO antibodies. And then there's another type of antibody I briefly want to mention called thyroid binding immunoglobulins or TSH binding inhibitor immunoglobulins. So these are also a type of TSH receptor antibody, and many labs don't offer this type of test. So even if you wanted to, you can't necessarily test for it. But it is a type of TSH receptor antibody. So if you were to, let's say, if you tested, again, I usually just test TSI, but if you tested TSI and TRAB, which is TSH receptor antibody, and if TSH receptor antibody, again, TRAB was positive and TSI was negative, then one can maybe conclude that if you were able to test the TSH binding inhibitor immunoglobulin, that that would be positive. I'm actually going to have another Q&A episode where I focus more on TSH binding inhibitor immunoglobulins. So I would stay tuned for that. But a little bit confusing in the literature. Some of them associated with Graves. Some say it has nothing to do with Graves' disease. So again, I'll talk more about that in a future episode. And if you're not following this, if this is confusing at all, I wouldn't worry about it. It's not important when it comes to lowering thyroid antibodies. I'm just kind of giving an overview of the different types of antibodies. And like I said, the main ones that you're going to test for: TPO antibodies, thyroid stimulating immunoglobulins, thyroglobulin antibodies. So those are the three main ones I would focus on. But like I said, it's really just an overview as far as going over the different types of antibodies. So, next question: when should you test the thyroid antibodies? So, most medical doctors, including endocrinologists, most of them don't test the thyroid antibodies at all. The only time they may test the thyroid antibodies if someone is diagnosed with hyperthyroidism or hypothyroidism, low thyroid or high thyroid hormones. So if the thyroid is normal, like let's say if they do a TSH, which unfortunately a lot of doctors, that's all they'll do. They'll do a TSH maybe as part of a physical. TSH is within the lab range. It might not be within the optimal range, but might be within the lab range. So they're not going to look at thyroid antibodies in that case. But if someone has elevated TSH, thyroid stimulating hormone, or not even elevated, but on the higher side, let's say it's like 3.5, which is within most lab reference ranges, but is above the optimal range. Again, they very well might have thyroid antibodies, especially thyroid peroxidase and or thyroglobulin antibodies. But most medical doctors would wait until the TSH is outside of the reference range before testing the thyroid antibodies. The thing is, the thyroid antibodies develop before the thyroid gland is affected. And again, just the presence of thyroid antibodies, it doesn't always mean that the thyroid is being affected. But still, if you have a family history of Graves or Hashimoto's, I think doing predictive antibody testing, even if it's every few years, is a good idea, just so you're aware that you have those antibodies. Because if you have the antibodies, that doesn't mean that you'll develop hyperthyroidism or hypothyroidism, but you very well might. So it's good to know that. Yet most doctors will wait until the thyroid gland is actually affected. So, yeah, so as far as when should you test the thyroid antibodies, I would say it would be a good idea to test them like if there's no history. Most people listening to this, most people have Graves or Hashimoto's, but if you don't, like if you're listening to this and you have Graves or Hashimoto's or the antibodies to both of these, and you have family members, like if you have children, again, I'm not saying that you should test your 3-year-old for thyroid antibodies, but in the future when they get a blood test, maybe I would test for thyroid antibodies again. So I wouldn't go out of your way necessarily to test for the thyroid antibodies in family members, but like I said, I do think it should be more of a screening process, like a pre-screening process, predictive antibody testing. Now, for those who have already been tested for thyroid antibodies, which probably describes a lot of people listen to this, most people listen to this probably, I would say when retesting the thyroid antibodies, ideally, like if everything was free, I would say test for it every single month. But honestly, I don't think that's always necessary. Sometimes it could actually cause more stress because, especially in the beginning, when you're trying to restore your health, the antibodies may fluctuate. So it might stress you out if you test them every month. But that being said, I wouldn't go like 6 months between retesting. I would say at least every 3 or 4 months. If you could do it every 2 months, that would be great. So I do like to keep an eye on the thyroid antibodies, especially, I mean, in the beginning, not as important when someone is starting to make changes to their diet and lifestyle and maybe doing some functional medicine testing. But as their health improves, eventually we do want to see positive changes in those antibodies. And then also, which of these thyroid antibodies should you test? Like, should you test all of these antibodies? So, a lot of people, when they see me with Graves, they might just have the thyroid stimulating immunoglobulins, for example. Should they test these other two antibodies? Or if someone has Hashimoto's and they have the thyroid peroxidase and thyroid globulin antibody, should they test the TSI? I mean, I don't think it's always necessary to do this. I mean, in the case of Hashimoto's, if someone has Hashimoto's, again, they might have positive thyroid stimulating immunoglobulins. And again, I know I just said predictive antibody testing. So, but again, if someone had a family history of Graves and they have Hashimoto's antibodies, then yeah, I would say good idea. And same if someone has a family history of Hashimoto's, but they tested positive for Graves, and maybe they should also test those thyroid peroxidase, thyroid globulin antibodies. I mean, it's definitely not going to hurt to look at all three antibodies. If you're paying out of pocket, might be a little bit pricey, but I will say the approach isn't going to be different. At least my approach and most functional medicine practitioners, if one has a single thyroid antibody, it's not like we're going to change our approach if someone has three thyroid antibodies. Now, if someone has hyperthyroidism compared to hypothyroidism, of course, the symptom management aspect is going to be different. But as far as treatment approach, it's not going to be different. That being said, sometimes you'll see if someone does have multiple thyroid antibodies, sometimes you'll see one normalize, but the other remain high or fluctuating. So if you only test one, and if it's elevated, but then eventually normalizes, it doesn't automatically mean that the other antibodies will normalize. So that's also something to keep in mind. And then, so another question, a question you probably don't have, but I'm going to bring up is how common are false negative thyroid antibodies? In other words, can you have Graves or Hashimoto's yet have negative antibodies? Can you have Graves' disease and have negative thyroid stimulating immunoglobulins? Can you have Hashimoto's and not have either thyroid peroxidase antibodies or thyroid globulin antibodies? The answer is yes. In the case of Graves' disease, it's not as common. Most people with Graves will have elevated thyroid stimulating immunoglobulins, and it is a little bit more common, it seems like, in those with Hashimoto's to have false negative antibodies. And you could do a thyroid ultrasound if you have elevated TSH, for example, and all the antibodies are negative, and see what the ultrasound says. I do have an upcoming interview with Dr. Alan Christensen, so he talks more about this. So definitely would tune into his interview if you're interested in learning more about the potential of negative thyroid antibodies. But just wanted to say it is possible. Now, with Graves, let's say if someone has hyperthyroidism and they have negative thyroid stimulating immunoglobulins, but they have the symptoms of thyroid eye disease, which is commonly associated with Graves' disease, then chances are they probably have Graves, even if they don't have thyroid stimulating immunoglobulins present on a blood test. So that's also something to keep in mind. So the $1,000,000 question, how can you lower and normalize thyroid antibodies? And I'm not going to get into great detail in this episode because that's why I put together a series of episodes. So I'm going to talk about food triggers and stress and chemicals and infections and healing the gut. But I'm not going to cram all of this into a single episode, which I've done in previous episodes where I spoke about thyroid antibodies. So I'm going to dedicate individual episodes talking about the different factors that could play a role in thyroid antibodies. And of course, that means that you would want to address those factors in order to lower and normalize thyroid antibodies. And again, I just want to remind you that it's not easy to lower and normalize thyroid antibodies. I mean, in some cases, someone might just go gluten free and their antibodies lower, and maybe in some cases even normalize. So I can't say it's never easy, but many times it's challenging and not that easy where you could just eliminate gluten, just clean up your diet, and the antibodies will normalize. Sometimes it is, many times it isn't. But that's pretty much all I wanted to cover here. And of course, I hope you found the information to be valuable. I'm sure you'll find the future episodes related to lowering and normalizing thyroid antibodies to be valuable as well. And as usual, I look forward to catching you in the next episode.